Good morning, Namaste. My name is Dr. Pankaj Talwar and I am a consultant at Birla Fertility and IVF. I am also the head medical services of the IVF division. At Birla Fertility and IVF, we offer compassionate care and clinically reliable fertility solutions to both men and women. We specialize in developing tailor-made solutions for all the fertility problems which will lead to huge success in the fertility outcome. So now we'll see what do we expect from our first consultation at Birla Fertility and IVF. After you would have taken the first appointment from the doctor at Birla Fertility and IVF and you visit the Birla Fertility and IVF to meet the doctor, let's see what all things you have to know and learn from the first visit and how to optimally utilize your time at the consultation. So let's see, how do you prepare yourself before your first visit to the clinic? It's simple. Keep all your documents together. I'm sure that by now you would have probably met many doctors before, maybe GPs, maybe gynecologists, maybe at some other IVF unit, or maybe you have taken some online consultations. So before you visit a doctor, get all the papers together, make a file. In case possible, attach all your investigations in a serial order, date by date, make a proper folder, and then you come to the clinic. Preparing yourself well for the first appointment at Birla Fertility and IVF will always help you to have better consultation, to have better outcome of the consultation and earlier treatment. So during your first visit to an IVF unit at Birla Fertility and IVF, the doctor will go through your folder. We would like to see and assess your previous folder, your previous documents, and there are certain things which are very important to have better outcome of the fertility treatment. These things are primarily some of your blood tests. So for the male partner, what is important for us is seeing your previous semen counts and semen analysis reports, maybe a semen culture report. And for the female, we like to review your HSG, laparoscopy or hysteroscopy. We'll also like to review for both of you your blood tests which are like HIV, HbSAg, VDRL and some other tests. We like to review your thyroid profile, your vitamin D, your blood sugars or any problem in case you've had before. Always provide the doctor with your previous surgical history. Always tell the doctor about your previous conceptions and in case they have failed in some way. During your first visit to an IVF unit or Birla Fertility and IVF, try to go with your partner or spouse. This will help in history taking and for the doctor to draw inferences about your clinical condition earlier. So what happens when you visit the clinic? First of all, as I've told you, a detailed history taking will be done and doctor will then physically examine you. Physical examination can be done in terms of examining your body weight. We'll take your blood pressure, look at your thyroid, and we would also carry out an ultrasound for you. Ultrasounds are being done transvaginally, which we normally call as a TBA scan. So be part of the treatment, be with the doctor, listen to him carefully what he is saying and always ask him questions. For everything you must say why or how. My advice to you from the Birla Fertility and IVF is that don't be a mute spectator in your treatment. Become part of the treatment. You're part of the team which is offering you treatment. The more you talk to us, the more you interact with us and the more confidence you have in us, I am sure they will all lead to better fertility outcome. What I have noted in my practice of nearly 20 years is that when you come to us unprepared. You come to a doctor with a lot of confidence and faith, but you don't know what you're expecting. You don't prepare your questions well, and though we speak for around 40 minutes to 1 hour in the first consultation, due to lack of interaction, the answer is not clear to you. So whenever you plan a fertility consultation, I request you that must prepare a checklist of the questions which you're going to ask the doctor. You ask the doctor, why am I not conceiving? What is wrong with me? Is my ovaries fine? Is my uterus fine? Is my thyroid okay? Are my vitamin D values okay? Am I having diabetes or hypertension? Are my tubes okay? Is my husband's sperm count okay? You must know that all these questions can lead to easy interaction and a more deliberate and a comfortable interaction, and this will empower you in the treatment of infertility. At Birla Fertility and IVF, we always encourage two-way communication, and I've said before also, we play the whole innings together. Many times you all come to us and you want an answer on day one. You say, Doctor साहब, हमें बताएं हम क्या करें, हम आपसे आज मिलने के लिए आए हैं, and give us an answer what you plan to do with us. Remember that at any clinic, with any doctor, we can't offer you a solution on day one. Everything depends upon a particular timeline, and the timeline for any infertility treatment at Birla Fertility and IVF will be probably 8 to 10 days or 15 days, when you'll undergo some sort of assessment, both physical, serological, and by some blood test. And after these have been done, then we can give you an answer. So we have to understand that on day one, the diagnosis can't be made, and you have to undergo some sort of investigations and treatment. Fertility treatment can be time consuming. It can be nerve-breaking, nerve-wracking, and sometimes psychologically shattering. It takes time. After all has been done, we have spoken, we have done your ultrasound, we have reviewed your medical case sheets and your documents, the doctor will give a diagnosis. The diagnosis may lead you towards a simple ovulation induction protocol in which we give you some tablets and we tell you about time intercourse. Or the doctor may give you an answer in terms of undergoing an IUI. And finally, if everything fails, we can also advise you undergoing in vitro fertilization and embryo transfer. In certain cases, doctor may offer you the treatment with the help of surrogacy or by oocyte or sperm donation, sometimes even embryo donation. So have faith on us, trust us, and I'm sure with hand holding, we'll go a long way forward, and I'm sure that very soon you'll get your own child. Thank you.